Welcome to the deep dive, where we take complex information, unpack it, and turn it into clear, concise insights just for you. Today, we're diving into something really fascinating and maybe surprisingly complex: lacerations and related pathologies in Camelidae and Cervidae. Now, you might hear lacerations and think, okay, cuts and scrapes, right? And yeah, it starts there. But what we found in these detailed veterinary reviews is this whole interconnected world of health challenges. We're talking camels, llamas, alpacas, and all kinds of deer. Our mission today: to pull out the most important nuggets from these sources. We'll explore how a seemingly simple injury can, well, snowball into really profound systemic issues. We'll look at how anatomy shapes disease and how our human interactions, farming, wildlife management fundamentally affect the health of these amazing creatures.
Yeah, and what's really striking is how often the signs might look similar,
Yeah.
between camels and deer, like lameness or maybe a skin lesion.
Yeah.
But the underlying causes, the actual physiology, and so the right treatment can be dramatically different. We'll be connecting those dots for you. Trauma, genetics, environment, even specific metabolic things.
Okay, so to really get into this, let's start with the basics. What exactly is a laceration in these animals? And why are they so common in both groups, Camelidae and Cervidae?
Sure. So a laceration, it's an open wound, but the key is it has torn or jagged edges. It can be superficial, just the skin, or go really deep, muscles, tendons, even bone.
Those jagged edges sound like trouble.
They are. Makes them much more likely to get infected or have healing issues compared to a clean cut. And for both groups, the main cause is trauma. Things like sharp objects, fencing injuries, falls, running into things.
So are there different types? How do vets classify them?
Yeah, we mainly classify them by depth. Superficial is just skin. Deep means it's gone into muscles, tendons, ligaments, maybe bone. And then there's complicated. That means there's extra stuff going on, heavy contamination, foreign bodies stuck in there, or nerve and vessel damage.
Got it. And what are the telltale signs? How would someone know their animal has one?
Well, the obvious one is a visible wound, usually bleeding, but also pain, swelling around the area, maybe lameness if it's on a leg.
Okay.
And if you see discharge or if there's a bad smell, that's a big red flag for infection.
Right.
Really bad infection can even make the animal sick, systemically fever, not wanting to eat, just lethargic.
So how do you diagnose and treat these?
Diagnosis usually starts with a good look and feeling the area, palpation. Sometimes we need imaging ultrasound for soft tissues, x-rays if we're worried about bone or foreign objects, or even gas, which points to certain nasty infections.
Yes. Wow.
Yeah, some bacteria produce gas. Treatment. It always starts with cleaning it out really well.
Yeah.
Debridement, getting rid of dead tissue and debris.
Okay.
Then, if it's a clean enough wound, maybe close it. If not, manage it as an open wound with bandages. Antibiotics are almost always needed because contamination is such a risk. Pain management, too,
Yeah.
with NSAIDs.
What are NSAIDs again?
Oh, sorry, non-steroidal anti-inflammatory drugs, like ibuprofen for humans, but animal-specific versions. And tetanus protection is really important, especially if you don't know their vaccine history.
So prevention sounds absolutely critical then.
Absolutely. It really comes down to managing their environment. Regularly checking pastures or pens for hazards, using safe handling methods, and doing routine health checks to catch things early, that's paramount.
Okay, so that simple cut can open the door to much bigger problems. Let's talk fractures. This is where things get really interesting, right? How do bones break in these animals?
Yeah, bone is incredibly strong, but it does have limits. Fractures happen when forces like tension, compression, twisting, shearing just exceed that strength. High energy impacts, like getting hit by a car, often cause what we call comminuted fractures,
Does-menended?
meaning the bone breaks into 3 or more pieces. Much harder to fix.
Are there specific fractures we see more often in camels versus deer, maybe linked to how they live or behave?
Yes, definitely. And the differences are fascinating. In camelids, especially dromedary camels, jaw fractures, mandibular fractures are incredibly common, like up to 55% of their clinical fracture cases.
55%, just the jaw.
Yeah. It's strongly linked to males fighting during rutting season. Their jaw is just anatomically weaker in one spot, the interdental space, making it prone to breaking there.
Wow.
And in young camels, under 2 years old, long bone fractures, especially the tibia, pretty common, often from being stepped on by adults or falls. Llamas. They can get humeral fractures, the upper arm bone, from chest butting during fights.
Okay, and what about deer? Cervids.
For cervids, a huge issue is deer vehicle collisions, DVCs, a massive cause of severe injury and death. Over 1 million incidents a year just in the U.S.
1 million. That's staggering.
It is. These often result in really severe open fractures of limbs, the pelvis, or spine,
Hmm.
often fatal. And like camels, aggression during rutting season is a
Mhm.
factor. Bucks can get antler, pedicle is the base the antler grows from. Yeah. And skull fractures. Pedicle injuries can mess up future antler growth or lead to really nasty, sometimes life-threatening infections. Falls happen too. Survival for wild deer with fractures is generally low, but we do find healed fractures sometimes, so some must survive the less severe ones on their own.
How do veterinarians classify these breaks? Is there a standard system?
There is, yeah, it's standardized based on a few things. Location on the bone, like mid-shaft or involving a joint. Configuration, is it a clean transverse break, oblique, spiral, or comminuted, like we mentioned? And severity, incomplete or complete, and how much displacement there is. But critically, we note if it's closed, meaning skin's intact, or open, where the bone's exposed.
Because of infection risk.
Exactly. Open fractures have a much higher risk of infection, and that hugely impacts treatment and prognosis.
So once it's diagnosed, how are they treated? And you mentioned a difference between camels and deer.
Yes, and this is a really critical point of divergence. Camelids are generally fantastic orthopedic surgical candidates.
Really? Why is that?
They tend to be relatively small, have a quiet temperament, and they tolerate being down recumbent for long periods really well. So surgical success rates are high. External fixation casts, splints works great, especially for young ones, crias, who heal fast. For tougher cases, we might use transfixation casts or external skeletal fixators, ESS, those metal frames you sometimes see,
Okay.
and internal fixation, using plates and screws or even wiring for those jaw fractures. Also very successful, often over 80% success for closed fractures.
Wow, that's impressive. So what's the story with deer then?
Ah, well, here's the twist. Cervids. Managing fractures in them is profoundly complicated by their innate flight response and this extreme susceptibility to a condition called capture myopathy, or CM.
Capture myopathy, right? You mentioned that. Can you break down what that is? It sounds like a major hurdle for trading wild animals.
It absolutely is. CM is a non-infectious but often fatal systemic disease. It's triggered by the intense physiological stress of being chased, captured, handled, or transported.
So the stress itself causes the disease.
Precisely. Any trauma, like a fracture, that requires capture for treatment automatically brings in this huge risk of causing CM. It's a secondary condition, but often more deadly than the original injury.
So trying to help them could actually kill them. How does that work inside their body?
Exactly. The extreme fear triggers a massive flood of stress hormones. This forces their muscles to switch from efficient aerobic metabolism to inefficient anaerobic metabolism.
Like sprinting flat out in total panic.
Kind of, yeah. This causes lactic acid to build up rapidly, leading to severe metabolic acidosis. Their body chemistry goes haywire. This whole cascade damages the heart, screws up electrolytes, and causes widespread muscle cell death necrosis.
Okay.
And those damaged muscle cells release myoglobin, which is toxic to the kidneys. That leads to acute kidney injury and failure.
Yeah.
Their system basically poisons itself from the stress response.
That sounds absolutely devastating. Are some animals more prone to it?
Ungulates hoofed animals are particularly susceptible. And cervids deer are really overrepresented in the reports. Fallow deer, axis deer, roe deer seem especially prone. Camelids can get it too, but their level of domestication often helps.
How so?
A more domesticated llama or alpaca might be less intensely stressed by human presence than a wild deer, making them somewhat easier to manage, generally speaking.
What are the signs of CM? Does it happen right away?
It can manifest in different ways and timelines. There's capture shock syndrome, sudden death during or right after capture, or days later you might see muscle stiffness and weakness. That's ataxic myoglobinuric syndrome. There's also ruptured muscle syndrome, where muscles literally tear, or delayed pericute syndrome, sudden death weeks later from heart failure.
Weeks later. Wow.
Yeah. Common signs include a really high body temperature, often over 105 Fahrenheit in deer, racing heart, rapid breathing, muscle tremors, and just getting progressively weaker.
Given how serious it is, what's the approach? Can it be treated?
Prevention is everything. Because honestly, treatment is often unsuccessful. The prognosis is grave once it sets in.
So how do you prevent it?
You have to minimize stress and exertion during any handling. Plan meticulously. Avoid chases. Use remote chemical immobilization like dart guns whenever possible. Keep things quiet, maybe use blindfolds. Monitor their temperature constantly. Use the right sedatives.
And if an animal shows signs?
Aggressive feed fluids, pain relief, muscle relaxants. But again, the outlook is grim.
So for a wild deer found with a broken leg, what's the realistic bottom line?
Often, it's either non-intervention, letting nature take its course, or humane euthanasia.
That's tough.
It is. The stress of capture and anesthesia alone can be lethal. For many closed fractures, especially if they're in a somewhat protected area, stall rest with minimal handling might be the best bet. They can heal on their own, though the bone might not set perfectly in Malunion.
Can you use casts?
External things like casts or splints are possible for lower limb fractures, but even that carries the CM risk because you have to handle them. Surgery, much less common. Mostly for young or really valuable animals in controlled settings, because even the stress of recovering from surgery can cause problems, like the implant failing or CM setting in. It's always a difficult risk-benefit calculation.
Okay, so we've covered trauma and fractures and this huge complication of capture myopathy in deer. Let's shift gears a bit to infections that can either mimic or complicate these injuries. Vesicular stomatitis virus, VSV. Why is this one such a big deal?
Right, VSV. It's a reportable disease, meaning legally you have to report it. And the reason isn't usually high death rates. Mortality is actually low. The critical issue is that its clinical signs, the blisters, look exactly like foot and mouth disease, FMD, in cloven-hoofed animals.
FMD, that's the really serious one for trade, isn't it?
Exactly. Because they look identical, any suspected case triggers this immediate major regulatory response. Quarantines, trade restrictions.
Right.
It causes huge economic losses, even if it turns out not to be FMD.
So what causes VSV and how does it spread?
It's a virus, vesicular stomatitis virus. In North America, it's mostly the VSV New Jersey strain. It's endemic, always present, down in the tropical Americas. It tends to move north periodically, usually in warmer months, May to October, often following waterways.
Waterways, why?
Because of the insect vectors. It usually disappears after the first hard frost kills off the insects.
So insects spread it initially?
Primarily, yes. Biting insects like sandflies, black flies, midges, they introduce it into a herd. But once an animal is infected, it spreads easily through direct contact with saliva or fluid from those ruptured blisters, or indirectly contaminated feed troughs, water buckets, that sort of thing.
Which animals get it? Is it just livestock?
No, it's got a broad range. Horses, donkeys, cattle, pigs, sheep, goats, and both New World camelids like llamas and alpacas, and Old World ones like dromedaries. And importantly, wildlife, too. White-tailed deer, elks are susceptible, and studies suggest they might act as reservoirs or amplifiers, keeping the virus around and potentially spilling it back over to livestock.
Okay, so what are the actual clinical signs we'd see?
Well, after about 2 to 8 days incubation, maybe a fever. But the real hallmark is the vesicles blisters, most common in and around the mouth, but also muzzle, teats, udder, prepuce, and right around the top of the hooves, the coronary bands.
And these blisters burst.
Yeah, they rupture pretty quickly, leaving these painful raw spots, erosions, or ulcers. That pain makes them drool excessively, froth at the mouth, not want to eat, so they lose weight. Hoof lesions cause lameness. Teat lesions can lead to mastitis. It usually clears up on its own if secondary bacterial infections don't set in.
So if it looks just like FMD, how do you tell them apart, and what should listeners absolutely know about reporting?
This is the critical point for anyone listening who owns susceptible animals.
Eh.
Any vesicular lesion, any blister, must be reported to your state or federal animal health officials immediately. No waiting. Diagnosis is confirmed only at national labs, usually using PCR tests on fluid from the blisters or tissue samples.
Right.
There's no specific antiviral treatment. It's supportive care, keep them hydrated, prevent secondary infections. Control is all about strict biosecurity. Quarantine, isolating sick animals, controlling insects, disinfecting everything.
And the key difference from FMD?
The key differentiator in the field. FMD affects all cloven-hoofed animals, but it does not affect horses. VSV does affect horses. That's your big clue.
Got it. Horses are the key. Okay, moving from external lesions, what about infections inside the body, like in the joints? Septic arthritis?
Right, septic arthritis, that's an orthopedic emergency. An infection inside a joint. It can rapidly destroy the joint cartilage, cause chronic pain, lameness, and even systemic illness.
How does the infection get in there?
Several ways. Direct trauma puncturing the joint, maybe from a medical procedure like an injection, it's not done cleanly, or spreading from a nearby infection. But most commonly, especially in young animals like crias or fawns, it's hematogenous spread.
Meaning through the blood.
Exactly. Bacteria traveling through the bloodstream from an infection somewhere else in the body, like an infected navel shortly after birth, NAVLE.
Are there specific bacteria we worry about in camels versus deer for this?
Yes, there are some key players. In young camelids, Mycoplasma species and Streptococcus hypolaxiae are really significant. They can cause severe joint damage. Also, Corynebacterium pseudotuberculosis, that's the one causing caseous lymphadenitis, or CL, and Staphylococcus aureus.
And for deer.
For cervids, Mycoplasma bovis is an emerging concern. It often spills over from domestic cattle, especially dairy cows, and causes really severe disease in deer. Truparella pyogenes is another common one, causing abscesses and joint infections.
How are these joint infections diagnosed and treated? What's the prognosis like?
Diagnosis relies on arthrocentesis, taking a sample of the joint fluid, the synovial fluid.
What are you looking for in the fluid?
Normally, it's clear and viscous. In septic arthritis, it'll be cloudy, watery, with a really high cell count, mostly neutrophils. A bacterial culture of that fluid is crucial to ID the bug and choose the right antibiotic. X-rays help see if the bone is involved.
And treatment.
It needs to be prompt and aggressive. Long-term systemic antibiotics, sometimes injected right into the joint too. Draining and flushing the joint lavage is often necessary, plus supportive care like NSAIDs for pain and inflammation and strict rest. But even with all that, the prognosis is often guarded to poor, especially if treatment was delayed. Cartilage damage can be permanent.
Okay, let's talk feet. You mentioned earlier their feet are fundamentally different. How does that unique anatomy influence the types of hoof problems we see in camelids versus cervids?
It's a fantastic point, and it really highlights evolutionary adaptation. Camelids, llamas, alpacas are padded foot animals. They walk on this broad, tough, leathery foot pad, almost like a dog's pad, but bigger, with a big cushion underneath. They do have toenails, but they aren't weight-bearing.
So problems arise when they're not on their native terrain.
Exactly. Their feet are adapted for high-altitude, dry, rocky ground. Put them in consistently wet, soft pastures, like in many parts of North America or Europe, and you get problems. Things like interdigital dermatitis inflammation between the toes or ulcerative pododermatitis where the pad itself gets infected, often because constant moisture softens the skin, letting bacteria in. Also, their toenails don't wear down on soft ground, so they get overgrown, which messes up their foot balance and can cause lameness. Regular nail trimming is essential.
Okay, and deer, totally different setup, right?
Totally different. Cervids have a classic cloven hoof, like cattle or sheep. They walk on the hard, keratinized walls of the two main digits built for traction. They also have two smaller dew claws higher up the leg.
So what kind of hoof issues do they get?
Several distinct problems. One emerging issue, especially in elk out west, is treponeme-associated hoof disease, TAHD, sometimes called elk hoof disease. It's an infectious disease causing really deformed, overgrown, broken, or even sloughed hooves. It leads to severe lameness.
What causes it?
It's polymicrobial, meaning multiple bacteria are involved, including Treponema species, similar to bacteria involved in digital dermatitis in cattle. It seems to be transmitted through contaminated wet soil. And sadly, there's no practical treatment for wild elk.
That sounds awful. What else?
Then there's laminitis, also known as founder, or sometimes slipperfoot. It's non-infectious. The hooves become overgrown, often curling upwards.
What triggers laminitis?
It's often linked to nutritional imbalances, especially a sudden switch to a high-energy, low-fiber diet. Think grain from feeders or bake piles.
Yeah.
This causes metabolic upset, inflammation in the sensitive layers of the hoof, the laminae, causing pain and abnormal growth because they're too sore to wear their hooves down normally.
Like founder in horses?
Very similar mechanism, yes. And finally, there's foot rot. This is an infectious pododermatitis, often starting after some kind of minor foot injury or in constantly wet, dirty conditions. It causes inflammation between the claws and usually has a characteristic foul odor.
Okay, that covers infections and foot issues. Now, what about problems that animals are born with or develop very early on? Angular limb deformities, ALD, or crooked legs. That sounds like a big one, especially in young animals.
It is. ALD is just a deviation of the limb from its normal axis, making it look crooked.
Yeah.
We classify it based on which way it deviates. Valgus means the limb deviates outwards. Away from the midline, think knock-kneed. Varus means it deviates inward, towards the midline, think bow-legged. And we name it based on the joint where the deviation occurs, usually the carpus knee or tarsus hoc.
What's actually causing the bone to grow crooked like that?
Well, the main cause of developmental ALD, the kind that shows up as they grow, is asymmetric growth at the physis, the growth plate of a long bone.
Meaning one side grows faster than the other?
Exactly. That imbalance makes the bone bend. Other causes, especially for congenital ALD, present at birth, can include loose ligaments around the joints, or incomplete bone formation ossification of the small cuboidal bones in the knee or hock. If those bones aren't solid, they can get crushed when the animal starts bearing weight.
Do the underlying reasons for ALD differ between camelids and cervids?
Yes, profoundly. And this is a really key distinction highlighted in the sources. For camelids, especially llamas and alpacas raised outside their native Andes, the overwhelming evidence points to hypovitaminosis D and rickets as the main cause of acquired ALD in crias.
Lack of vitamin D.
Yes, they evolved in high-altitude areas with intense UV sunlight, crucial for vitamin D synthesis. Raise them in lower altitude, often cloudier regions, especially during winter months, and they just can't make enough vitamin D. This impairs their ability to absorb phosphorus, which is essential for mineralizing bone, so their bones stay too soft and bend under pressure.
Are some crias more at risk?
Definitely.
Yeah.
Those born in the fall or winter, when sunlight is weakest, and those with dark fleece, which blocks UV penetration to the skin, are at highest risk. Carpal valgus knock-knees is the most common form we see.
Okay, so vitamin D is the culprit in camelids. What about deer, farm deer, and elk?
In farm cervids, the story seems different. The primary issue identified in affected stags is physeal osteochondrosis.
Osteochondrosis, what's that?
It's a disorder of bone formation specifically at the growth plate. It's considered multifactorial, multiple things contributing. It seems linked to the intense metabolic demands of rapid growth, especially in young stags being pushed for weight gain or velvet antler production. This puts excessive biomechanical stress on those growth plates, leading to abnormal development.
So less about a specific vitamin deficiency and more about growth pressure.
That seems to be the case. While nutrition is always a factor in bone growth, the specific link isn't as clear-cut as the vitamin D deficiency in camelids. And interestingly, in deer, carpal bowlegs is more commonly reported than valgus.
Fascinating. Different causes, similar looking problem. How are these crooked legs diagnosed and treated?
Diagnosis starts with a physical exam. Sometimes for camelids with thick fleece, you actually have to wet the leg down to see the bone alignment clearly. Radiographs X-rays are essential. They help pinpoint exactly where the deviation is pivoting from, measure the angle, and look at the growth plates themselves for signs of rickets or osteochondrosis.
And treatment options.
It really depends on the cause, how severe it is, and how old the animal is. For mild cases, or in very young newborns, conservative management might work controlled exercise, maybe corrective hoof trimming, or splints and casts. For camelids with rickets, vitamin D supplementation is absolutely key, both for treatment and prevention. It can be given by injection or orally.
Can surgery fix severe cases?
Yes. If the deformity is severe or doesn't respond to conservative treatment, surgery is an option, especially if the animal is still growing. The procedures aim to correct the growth imbalance, either by speeding up growth on the slow side, periosteal stripping, or slowing down growth on the fast side, transphyseal bridging. Prognosis is generally good if it's caught and treated early.
Are there other significant congenital defects problems present right at birth that are important in these animals?
Yes, and again, we see a difference in what's commonly reported, likely due to domestication versus wild populations. In camelids, because of more intensive breeding and observation, we have a better handle on specific, often heritable defects. The most feared one is probably choanal-atresia.
What is choanal-atresia?
It's where the back of the nasal passage is blocked, usually by bone or tissue. Crias are obligate nasal breathers. They have to breathe through their nose.
Oh, no.
Yeah. So if both nasal passages are blocked, bilateral CA, the crias is in immediate severe respiratory distress. They often inhale milk, trying to breathe while nursing, leading to fatal aspiration pneumonia. It's highly suspected to be genetic, so affected animals or their parents shouldn't be bred.
Are there others in camelids?
Yes, things like maxillofacial dysgenesis, sometimes called wry face, where the face is twisted, often seen alongside CA arthrogryposis, where joints are fixed or contracted at birth, and certain heart defects like ventricular sepal defects, VSDs, holes between the heart chambers.
And what about in deer? What congenital issues are seen there?
In Cervidae, especially wild ones, the picture is less clear. Severe defects often mean the fawn doesn't survive long due to predation or just inability to thrive, so they get removed by natural selection before we ever see them.
Makes sense.
So most reports are from hunter-harvested animals or deer in captivity. We see isolated skeletal issues sometimes, like arthrogryposis or bowed limbs. In some small, potentially inbred populations, there's a higher incidence of things like cervical ribs, extra ribs in the neck area. One interesting syndrome is linked to piebaldism.
The white patchy coat.
Exactly. Deer with that piebald pattern often have a whole suite of associated congenital defects. Skeletal problems like shortened or crooked legs, a distinctly bowed nasal bridge, sometimes called a Roman nose. Severely affected piebald fawns has a very low survival rate.
So we've covered a lot of ground lacerations, fractures, capsular myopathy, infections like VSV and septic arthritis, fit problems, limb deformities, congenital defects. Quite the journey. When you synthesize all this, comparing Camelidae and Cervidae, what are the really big takeaways?
Yeah, if we zoom out and connect all these pieces, I think a central theme is this. Even when the clinical signs look really similar on the surface, lameness, skin issues, limb deviation, the underlying reason, the pathophysiology, and therefore the right way to diagnose and treat can be vastly different between these two groups.
Like the angular limb deformities example.
Exactly. In camelids, ALD is often a clear metabolic issue, vitamin D deficiency causing rickets. So a blood test for vitamin D is a key diagnostic step, and supplementation is core to treatment. In farm deer, it looks more like osteochondrosis, possibly driven by the biomechanics of rapid growth. Different starting point, same target, the growth plate, leading to a similar-looking outcome. It's like a convergent pathophysiology.
And the huge difference in managing trauma.
That's another major divergence. The relatively docile nature of many camelids makes them great candidates for orthopedic surgery, with high success rates. But for cervids, that extreme susceptibility to capture myopathy creates this dangerous laceration myopathy cascade. The very act of trying to treat the injury can trigger a fatal stress response. So for wild deer, the threshold for intervention has to be much higher. You lean towards non-interference or euthanasia far more readily than you would with a llama or alpaca with a similar injury.
What about VSV? The significance there seems universal because of the FMD mimicry.
Absolutely. The primary importance of seeing those blisters isn't just the VSV itself, it's that it looks identical to foot-and-mouth disease. That mandates an immediate, full-scale regulatory response, regardless of whether it's a deer, a llama, or a cow. So the rule is, see vesicles, report immediately. Rule out FMD first.
And how does looking at congenital defects show the impact of human influence?
It's quite revealing, isn't it?
Yeah.
In domestic camelids, we have well-defined, often recurrent syndromes like choanal with strong evidence for being heritable. Why? Because these animals often survive long enough, thanks to human care, to be diagnosed, studied, and their genetics tracked through breeding records.
Whereas in the wild?
In wild deer, natural selection is pretty brutal. Severe defects often mean rapid death. So we tend to see reports of more sporadic, isolated anomalies rather than clearly defined heritable syndromes, simply because affected individuals don't stick around long enough to be studied in large numbers. It really shows how domestication changes our window into animal genetics and disease.
So bringing it all together for management, what are the key integrated strategies for people managing captive herds versus those dealing with wildlife?
Okay, for captive herds, farm deer, llamas, alpacas. First, nutritional management. For camelid crias, especially those born in winter or with dark fleece, prophylactic vitamin D is crucial. The sources suggest around 1,000 to 2,000 international units per kilo of body weight, maybe injected every couple of months or given orally more frequently through the winter.
And for farm deer?
Careful diet balance is key to support healthy bone growth, specifically avoiding sudden shifts to high-energy feeds that can trigger laminitis or maybe contribute to osteochondrosis. Second, biosecurity and disease prevention. Strict biosecurity for things like VSV insect control, quarantining new animals for 3 weeks, disinfection, and trying to minimize contact between farm deer and other livestock like cattle to prevent disease spillover, like Mycoplasma bovis. Third, genetic and breeding management. Pretty straightforward animals with known or suspected heritable defects, like CA in camelids, or maybe severe ALD not linked to nutrition, shouldn't be bred.
Makes sense.
And fourth, husbandry and environment. Clean, dry housing helps prevent foot problems. Regular hoof or toenail trimming is vital. And designing facilities and handling procedures to minimize stress and physical trauma.
Okay, and for wildlife management or rehabilitation?
For wildlife management and rehab, the priorities shift a bit. Top of the list. Handling protocols laser-focused on preventing capture myopathy. That means using remote chemical immobilization whenever feasible. Keeping chase times incredibly short, ideally under 5–10 minutes. Using blindfolds, keeping things quiet. Avoiding capture in extreme heat. Everything geared towards minimizing stress.
Okay.
Second, triage and intervention thresholds. You need a much higher threshold for intervening with injured wild cervids. Remember, many can heal less severe injuries on their own. The decision to capture must weigh the injury severity against the very real risk of causing fatal CM. Euthanasia is often the kindest choice for severe injuries like open long bone fractures. And third, disease surveillance. Continued monitoring by wildlife agencies for diseases like VSV or M. bovis at that interface between wildlife and livestock is critical for early detection and understanding transmission dynamics.
Wow. From just a simple cut, we've really traced these intricate connections between anatomy, physiology, environment, genetics, and human actions. It underscores how much context matters in understanding animal health, doesn't it? What's the big final thought this leaves you with?
It really makes you think, doesn't it?
Yeah.
When we look at the health and welfare of these incredible animals, whether they're roaming wild or living under our care, it poses a fundamental question. How much does our human footprint, our expanding cities, our farming methods, even our attempts to help ultimately shape not only the challenges they face, but also our very capacity to understand and effectively address those challenges? It's a complex responsibility we carry.